Welcome to our healthcare database by Nicole Grillo, Pritesh Kumar Patel, and Braden Swope. The digitization of healthcare has become an overwhelming trend over the last decade. The movement from paper documents to an online area to store files has become a more efficient and streamlined area for healthcare professionals to provide quality care to patients. Healthcare databases strive to create a better system for lab systems, financials, patient satisfaction systems, patient identification, insurance claims, and etc. Healthcare databases are at the forefront for creating better and more efficient hospitals for both the employees and the patients. Our idea was to create a secure and functional database. It was simple. Create a database that is both functional and practical for individuals within the healthcare field. In healthcare, privacy and integrity of records is at the utmost important, and therefore it is necessary to ensure they remain protected. The goal of this assignment was to create a database and then to secure it and use it to analyze the importance of being aware of extremely treatable diseases is found early. Our goals were to create an efficient and working database for a healthcare provider, normalize all the data to import it into MySQL, correlate the data by using primary and foreign keys and creating relationships between the table, create the proper security necessary for this database, correctly analyze the database in order to spread awareness about important issues. This is our EER diagram. We had 5 tables that we interacted with each other. The physician's table, which was just the physician ID made by the query, the physician name, and the specialty, which connected to the physician office, which had the physician name again, a specific physician office ID, and then the location of the office. The insurance had the insurance ID, which already came with the insurance, and then the insurance company effective and expiration dates, etc. The patient ID had all of their specific information, so their first name, last name, their date of birth, gender, social security, and then blood type and organ donor. Their contact information had everything to do with where they live, what they prefer to be contacted with, their occupation, and their emergency contact. So creating the database. The first step was to remove all the relationships that the enhanced entity relationship diagram currently had. The next step was then to forward engineer the EER diagram to create the Group 1 schema. After the Group 1 schema was created by running the engineered script from the EER diagram, it was then necessary to import the data. The data was all a normalized Excel spreadsheets that was created based on the tables that we showed you previously, and we had saved in a UTF-8 CSV format. It was then imported through each table by creating a relationship between a header from a MySQL column and then the Excel delimited columns. And then before creating the relationships with the table, we ran the query set foreign key checks to 0, ensuring that the database then allow us to create relationships based upon the table's primary keys. So this would be an example of how we created relationships. This is just the graphical user interface area. So this kind of just shows you where we built the relationships. But in our database, we had scripted various relationships between the tables by setting foreign keys and then joining the primary keys. And after we checked our work, we also made sure of this through the graphical interface, which is now showing right now. This is our finished product pre-analysis. So this basically shows you that we have all the tables, and then within the table, for example, patient, there's all the columns, and it tells you what type each column is. The database ended up having 5 tables within the various relationships to ensure the queries could be properly analyzed and run and provide meaningful answers to the user. So our database security procedures, because this is a healthcare database, it is of essential and of utmost importance in order to make sure that it was secured. Between the individuals working on the database, we kept all admin availability because we all had to be able to edit, add, or delete. For our database, we decided it was best to have employee training, or rather the education of others on how to utilize our database. This presentation, for example, helps ensure any who interact with our database understand it and therefore know the importance of its integrity. Access control was another key notion that we prepared for. In this case, all of us had complete access to the database, as we all need to be able to edit, delete, and add data as we see fit. We also ensured that the database had some data loss prevention by making sure that the MySQL Workbench auto-saved after any interaction with the data. So this slide would be an example of queries used. This, for example, is going to be the query to see if someone has had a colonoscopy or a breast exam, and after a certain birth date. So the particular query is to answer number 2. The procedure to our method of answering each question was to first query the database, and second to export whatever was called from the database back to Excel so we can find the proper answer. We basically created tables within the Excel based off of what we received from our database, and then we're able to analyze the situation. In this case, it was clear that a good portion of this database contained individuals with expired insurances. In this case, we also found that there's a certain amount of people that had gotten a colonoscopy or a breast exam with a certain birth date. So why are breast exams important? So now we're going to get to the awareness topic of our presentation, and today we're going to discuss the breast exam and colonoscopy awareness and the importance of these exams when it comes to overall health. Breast exams are so important, and to understand that, we are first going to delve into individuals that are at average risk for breast cancer. Individuals who are at average risk for breast cancer are people who do not have a personal history of breast cancer in their family, do not carry any genetic mutation, specifically the BRCA gene, and who are also have not endured any form of chest radiation before the age of 30. Women within the age range of 40 to 80 are in the interval of individuals who are at high risk for developing breast cancer. Women between the ages of 40 to 44 should start getting mammograms every year. Women between the ages of 45 to 54 is highly recommended to get mammograms every year. Regular mammograms can help find breast cancer in its early stages, which is crucial to a successful path of treatment. This graph describes breast cancer cases by age. As you can see by the chart, individuals between 40 to 80 years old are more likely to develop breast cancer. And you could see that through, if you look at 40 to 49, 50 to 59, 60 to 69, 70 to 79. Clinical breast exams are very important, as medical professionals will be able to identify any abnormalities better than most and will be able to expedite the help of treatments if necessary. Breast exams always ensure individuals are able to catch irregularities and abnormalities early on so that the treatment is successful. Clinical breast exams also help healthcare providers find any issues that may be overlooked by an individual performing a self-exam, and it is very treatable when found in earlier stages. So this slide shows the cancer deaths for women in the United States in between 2009 and 2019. As you can see, breast is the second one, and it is probably one of the most prevalent cancers among women between 2009 and 2019. So let's move on to why colonoscopies are important. Colorectal cancer is the second leading cause of cancer-related deaths in both men and women in the United States. Colonoscopies are a procedure that involves the insertion of a tube into the rectum and near the top of the colon to get a direct visualization of the lining of the colon called a mucosa, to biopsy the mucosa, and finally to remove any polyps or growths within the colon. Tests like colonoscopy serve as both the early detection for polyps that may develop into cancer and as treatment when the abnormalities are removed and biopsied. The polyps that grow along the inner wall of colons tend to be more regularly seen within individuals over the age of 50. The colon usually in the early stages of colorectal cancer present have no symptoms, which is why the colonoscopies are so important, because if found early, colon cancer is very treatable. This right here is a slide about the cancer rates for cancer during the period of 2011 to 2015. As you can see, the two top cancers are breast, and then colon rectum is pretty much coming up to a close second. From our database, we found about 140 people had expired health insurance within the database, and that about 52% of the database were individuals who did not get regular breast exams or colonoscopies, which meant about 48% of those people are doing what they can to prevent cancers that are easily treatable if found early. It was shocking for us to think about how such a massive database could have such a large scale of individuals who are not doing what they can to make sure they can prevent potentially fatal diseases. So what we learned. Overall, this project proved to be very challenging. It is hard to learn how to collaborate with others, specifically on ventures that you're all learning together. Within an online class, there will always be challenges, but our group met them by trying to work together in a way that everyone benefited from the experience. The best part of the project was feeling very fulfilled by the result of a completed database and creating an analysis of queries that resulted from the data that we normalized. Again, this project was very challenging, but at the same time, was very beneficial to all our futures with the information technology. And right here is just our bibliography of sources we use besides our database.